Normal aging is associated with the development of low-grade chronic neural inflammation, which contributes to cognitive decline in age-related pathologies. There is an urgent need to develop novel anti-inflammatory therapeutic agents to prevent dementia in Alzheimer's disease. The sixth leading cause of death among all U.S. adults. Alzheimer's is an irreversible progressive neurodegenerative disorder that currently afflicts nearly 6 million Americans. The rates of Alzheimer's death have increased recently to more than 50% between 1999 and 2014. Current estimations predict that by 2050, nearly 14 million people in the U.S. will be afflicted with Alzheimer's. In this study, we examined the effect of two superoxide dismutase mimetics, VACNO and SanFlow, on cognitive impairment and neuronal structure in the scopolamine-induced rat model. These two superoxide dismutase mimetics function as a superoxide dismutase and reduce free radicals and oxidative stress. Since oxidative stress leading to vascular defects is associated with Alzheimer's, we predict that these drugs may protect against neuronal damage seen in progression of Alzheimer's and prevent or reverse memory loss associated with the progression of the disease. The aim of this study is to compare VACNO to SanFlow and its potential to protect the brain from cognitive impairment and neuronal damage in the scopolamine-induced Alzheimer rat model. Figure 2 depicts VACNO and SanFlow. Polynitroxylated albumin, also known as VACNO, is composed of the core protein human serum albumin conjugated to nitroxides. VACNO penetrates the vasculature, lymphatics, and extracellular space and serves as a strong extracellular superoxide dismutase mimetic, a weak catalase mimetic, and increases blood flow. SanFlow is composed of the core protein hemoglobin and caged nitric oxides and is pegylated. The pegylation helps the drug evade the immune response. SanFlow travels in the vasculature and is composed of a strong superoxide dismutase and catalase mimetic. SanFlow has been shown to increase blood flow and decrease oxidative stress. We hypothesize that the use of macromolecular superoxide dismutase mimetics, VACNO and SanFlow, will reduce scopolamine-induced cognitive dysfunction and neurological damage. In this particular study, we divided Wister-Hahn rats into 6 groups, with 2 groups serving as a no scopolamine control and then treated with VACNO and SanFlow. The other 4 groups were treated with scopolamine and then treated with vehicle, VACNO, SanFlow, or donazepam, which is an acetylcholinesterase inhibitor and served as a control. Donazepam has FDA approval for treatment of Alzheimer's and is clinically available as a potential treatment, but it has limited benefits. The rats were treated with either scopolamine and vehicle and then treated with vehicle, VACNO, SanFlow, or donazepam, and cognitive function was assessed with the passive avoidance test at days 7 and 8. Amygdala and hippocampal dependent memory were assessed using a step-through passive avoidance test in which the latency time to enter the dark compartment indicates an improvement in memory retention. On day 9, rats were euthanized, brains were collected, fixed, and frozen for histopathological analysis. Figure 3 illustrates that during the training phase of passive avoidance test, no statistically significant differences could be detected in terms of latency to enter the dark compartment between all treatment groups compared to scopolamine and vehicle-treated animal groups. However, during the testing phase, control animals that were treated with scopolamine and SanFlow spent statistically more time in the light compartment than animals treated with only scopolamine. In addition to assessing cognitive function, we have examined the structure of the rat brains used in this study. When astrocytes are activated, they secrete neurotoxic substances and show increased expression of gliofibrillary acidic protein, GFAP, which is a marker for astrocytes following injury or stress to the central nervous system. The decreased GFAP staining observed in our VACNO and SanFlow treated mice, figure 5, suggests less injury or damage in the form of activated astrocytes in the dentate gyrus of the hippocampus. Overall, all the animals which were enrolled in the study were in fair health condition and could perform all the tasks throughout the entire project. The treatment was well tolerated and no animals died during the treatment period. The passive avoidance testing assessing amygdala and hippocampal dependent memory revealed no statistically significant difference in latency between all treatment groups during the training phase. However, during the testing phase, animals treated with scopolamine and SanFlow showed statistically significant increased latency to enter the dark compartment compared to animals treated with only scopolamine, suggesting increased memory retention in the SanFlow treated rats. Reduced glial fibrillary acidic protein immunoreactivity in the VACNO and scopolamine and SanFlow and scopolamine treated rats compared to animals treated with scopolamine alone suggests that both VACNO and SanFlow reduce scopolamine-induced astrocyte activation, suggesting decreased osteogliosis and a protective effect on neurons. Since SanFlow may be beneficial in terms of memory improvement, the effect of these SOD mimetics on neuronal changes and cognitive impairment in Alzheimer's needs to be explored more extensively.